Welcome everyone. Thank you for joining us today. I'm Teresa Marantat, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please be reminded that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. For area businesses, visit our website to access our Safe Return to Business Toolkit. I will now report our current case counts. There are 108,155 confirmed cases of COVID-19 in Canada and 36,839 cases in Ontario. Chatham-Kent has 168 cases, and Sarnia-Lambton has reported 286 cases. Michigan now has 69,722 cases, with 11,961 cases being in Detroit. Today, we are reporting 1,829 cases of COVID-19 in our community, an increase of 14 cases from yesterday. 7 are workers in the agri-farm sector, 6 are in the community, 1 is under investigation. 1,197 cases have now resolved. 538 people are self-isolating. 26% of our cases are between the ages of 20 and 29 years. 24% are between the ages of 30 and 39 years, and 17% are between the ages of 40 and 49. 65% are male and 34% are female, with 1% unknown at this time. Our community has lost a total of 68 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 2 long-term care and retirement homes in COVID outbreak. In addition, there are 5 workplaces in the agriculture sector and 1 workplace in the manufacturing sector experiencing a COVID-19 outbreak. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you are feeling confused or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. SOHAC in Windsor and also offers testing for First Nations, Métis, and Inuit people and their families. To check your results, please go to www.wechu.org and click on View Your Results to access the online test results portal. If you are unable to view your results, please contact the assessment center or provider that initiated your test for your results. The WeChu will call anyone who has a positive test result. To follow up on a question we received yesterday regarding complaints and compliance inspections, since the beginning of July, we have completed 154 inspections related to patio regulations and masks. Please continue to visit our website at wechu.org for the most current information and case counts. Today, I am pleased to announce that the Windsor-Essex County Health Unit has partnered with the University of Windsor in the Cohesion study. The Cohesion study is a long-term study about COVID-19 being conducted across Canada, led by a team of epidemiologists, public health researchers, mental health experts from the University of Montreal, as well as by academic partners at the University of Windsor and various public health authorities from across the country. Joining us today is Dr. Kate Zinsser, Assistant Professor in the Department of Preventative and Social Medicine at the School of Public Health from the University of Montreal, and one of the principal investigators on the Cohesion study. Also joining us is Dr. Kevin Milne, Associate Dean of Academic Programs in the Faculty of Human Kinetics at the University of Windsor. They will provide an overview of the study, how residents can get involved, and how these findings will benefit the Windsor-Essex County community. We encourage all eligible Windsor and Essex County residents to explore this opportunity.
Great. Thank you so much, Teresa, and thank you to Windsor-Essex County Health Unit for having us on today. So the events that we have experienced and continue to experience because of COVID-19 have had major impacts on our society and on our lives. Many aspects of our daily lives are being called into question: how we live, how we work, how we play, and even how we interact with one another. With the lockdown measures, we have also realized the importance of our housing, the quality of our neighborhoods, and of course, the healthcare system, and how this differs across communities in Canada. And unfortunately, we have seen the differences in COVID-19 across neighborhoods and in communities, which is related to inequalities. And these inequalities have existed for a long time pre-COVID-19. It is essential to understand how we as a society continue to cope and how this evolves over time, for example, with the Stage 3 COVID-19 reopening in Ontario. So Cohesion is a longitudinal study across Canada with the goal to better understand the impacts of the pandemic, to help us build a better, more inclusive, and more sustainable future for communities where everyone can thrive. You may ask, why participate? You can participate in the study and add your voice to the great debate about COVID-19, the interventions, but as well as what is important for our society in the future. It is crucial to build a future that takes our differences into account, and everyone's voice is important. That is why anyone who is 15 years old and older and lives in Canada can participate in Cohesion. We have a study website that explains the study, where you can consent to participate, and then you'll be connected to your first questionnaire. There are bi-monthly or twice-a-month questionnaires that take about 10 to 15 minutes to complete, and it will ask questions on your health, your mental health, activity spaces and your social interactions, physical activity, food and health insecurity, and housing conditions. We will also provide phone support to participants that are not able to complete the questionnaires online. And it's important because the data you will provide through your participation in Cohesion will be part of a larger base of information, along with the other Cohesion participants, to support better decisions on COVID-19 containment measures and to support programs and interventions for those of us that are not coping well with the current situation. Importantly, beyond COVID-19, this information will help inform decisions, programs, and policies for a more sustainable society and to help make our future more inclusive, more just, and healthier. And now I'll pass on the mic to Kevin, who can explain the Windsor context for Cohesion.
Thank you, Kate, and thank you, Teresa, for giving us the opportunity to speak here. To follow up on some of the things that Kate has said, first I just want to note that, the University of Windsor, is a pillar in the community. Universities, wherever they are in a community, should be pillars there. We have nursing students and faculty, medical students who've been working on the front line since the beginning, psychology faculty who've been, providing counseling to healthcare workers and now residents of the community. Engineers and scientists working on better PPE and other devices, business faculty who are looking at the effects of some of the mitigation procedures or policies on small businesses. We partner with the We Spark Institute, which provides funding for many of our researchers to do work. And in the faculty that I'm in, human kinetics, we're looking at the, health, both physical and mental, of people throughout the community and Canada. And so, I'm happy to say that when I heard about this study, Dr. Sherry McGowan, who's Associate Dean of Graduate Studies, and myself, and a very close working colleague, when we heard about the study, we thought that this is something that the people of Windsor-Essex, we thought it was really important for us to have a voice in a national study about how we are, coping with, again, the policies that are in place and the pandemic as a whole. And so, being able to facilitate the meeting between Dr. Zinzer and the other PIs of the study and the Windsor-Essex County Health Unit, I think, provides the people of Windsor a voice in that message. So as Kate pointed out, some of the decisions that will be made in the future, current decisions and offering support programs for those people who are finding it more difficult than others, I think it's really important for us to be a part of that. As we move forward, we hope that the University of Windsor can play a bigger role in the study, but as of right now, we're happy to facilitate this meeting and also, recommend that the community does, let the researchers, which ultimately will come back to the health unit as well, let them know how we were doing during these difficult times.
Thanks, Kevin. And
The
if I could
conference
just
is now unmuted.
Sorry, go ahead, Kate.
Yes, sorry, I was just saying, and I think that's a very important point, is the partnerships that are involved in order for this study to be as relevant as possible. So it takes, it takes the academic researchers, but also the partnerships with local public health authorities is crucial in order for us to be able to apply the results of the study. And so we are very appreciative of Windsor-Essex, County Health Unit in the partnership here. And I think, I think there's a wonderful opportunity to really help inform programs and interventions.
Kate, could you just lower the volume on your computer, please? We're getting a little bit of an echo. Thank you. Okay, we'll now take questions from the media. We'll start with the Windsor Star.
Hi there, it's Julie Kostas from the Windsor Star. Good morning. So my question's for Dr. Ahmed, if I could. So Doctor, are walk-in medical clinics restricted from seeing patients who work in Michigan and commute home to Windsor-Essex County?
There are no restrictions that these people who are working in Michigan cannot go to walk-in clinic. I think if they need, they can go to. They have to follow the precautions. They have to ensure that they're following all the guidelines and ensuring wearing the mask and booking an appointment and getting in time. So whatever the clinic policy is, they have to make that policy. They have to follow that policy.
Okay, and can the medical clinics set a policy where they restrict these patients, say, for example, telling them that they have to quarantine or self-isolate for 14 days before they can go to the walk-in clinic?
I don't think so. I think the business, as a business themselves, they can set up their own policies, but there is no such requirement from the public health or from any government agencies to not to allow them to come for their medical needs. I think they just need to make sure that they are following all the appropriate precautions and guidelines before they can be seen.
Okay. And can any type of business set their own policy in regards to that, say like a salon?
Well, I think it's the businesses, and they can set up their own policies. Like, I don't think that anyone, like any private business in particular, if they are setting up any kind of policies, they can set up policies, but I think they need to understand what kind of implications it may have on their business. From a government and regulatory perspective, the policies and guidelines are set up in the better interest of the entire community, and there is no such restriction that we have put in place. We did recommend that anyone who's traveling to the United States is to limit their contact with the rest of the community as much as possible, and preferably do a work-home self-isolation where they're just working in Michigan, especially if they're a healthcare worker, and then they're just staying home and not interacting with the rest of the community.
Right. And then speaking about frontline workers, can a business tell a person to leave if they find out that that person is a frontline worker, even if they're following all the precautions, wearing a mask, et cetera?
Well, it would be entirely up to the business that how they want to run their business, and I think we do not have any such recommendations in place. So I think that the businesses can make a decision, but I cannot comment whether they should or they shouldn't.
Okay, my final question is there, it's probably just a clarification, but is there any kind of a quarantine period for people who work in Michigan and return home to Windsor-Essex County on a daily basis?
For those who are traveling on a daily basis, most of them are essential workers, and there is no such restrictions in place as long as they are just going to work and then returning back home without conducting any other type of business. If they are engaged even in maybe just a shopping or something, they fall under the criteria for the Quarantine Act, and some of these questions are being asked and are implemented by the Canadian Border Security agencies, and they will continue to do that. But as such, anyone who is going just for work, to my understanding, there is no requirement for them to do a 14-day self-quarantine, unless they're just going in for any other type of business.
Okay, thank you very much.
Any questions from CTV?
Yes, good morning, everybody. Yeah, I'll start off with the study first of all. So I'm just curious, how long has this study been around? Because I'm just looking at the website, it looks pretty slick. So has it been around for a while, or are you guys just launching this?
We launched at the beginning of June. And so now we are, and we have several partners across the country, but we're still developing our partnership. We'd like to be as inclusive as possible.
Okay, have you gotten a lot of reactions from it so far?
We have about 1,000, I think just under 1,000 participants signed up so far. And our goal is to have, but our goal is to have 1,000 per province and territory. So we have quite a bar to get to, I would say. But it's really helpful for us to partner with local health authorities to help with recruitment.
Okay, which leads me to Kevin, I guess. Your interest in this, of course, is to be involved. But in order to make this study, what it needs to be, how many people do you need, Kevin, to get involved?
Yeah, so I mean, and Kate might have a little bit more experience with these types of studies, but we've done, survey type studies, and the more people, the better. I would hope that if you're looking for 1,000 people from the province, that we're a third at least or a half of that number. But again, the more people, the better. Just like any, scientist that you're looking at data. The more data points you have, the more confident you can be that you're actually seeing something that you can make some change over or influence further decisions. So the more people that can respond, especially being in Windsor. I'll just make this point. I was born in Toronto. I live in Windsor. I think Windsor is one of the greatest communities in Canada. Unfortunately, we're maybe moving a little bit slower than the rest of the province, and so we might have some, very unique answers or experiences to share, especially in this research study. And so, I want us to have a voice, and it's really important for all people, all communities to have a voice in national studies such as this.
Okay, well, kudos to you for taking the lead on that one. And for Dr. Ahmed, your part in all this, just the importance of getting this message out. Obviously you're putting your name on it. So give me your thoughts on it, please.
I think in any type of, emergencies or public health events, there's a lot of opportunity to learn from it. And research activities like these provide us a good measure and good answers to some of the questions that can be implemented even right now and are prepared for the future. And obviously, as a scholar myself, I definitely support all these research activities as long as it meets the different ethical requirements and has some purpose attached to it. So we definitely want to support that. And we're happy to be promoting this study and encouraging people to participate in that study, because this is clearly a great study with a lot of good objectives, and we're hoping that more and more data would help us learn from it and apply it in the future.
Okay, just one more sidebar, I guess. Mayor Dilkins yesterday sent a release out saying he's concerned. He says he feels more attention and support is needed from the provincial and federal government to deal with the farm crisis before we can move into phase 3. I just want to get your thoughts on that, what you thought or what you think.
Well, I think all levels of government are engaged right now with different roles and responsibilities, and I think as we are learning more and more from even our experiences, dealing with some of these farms, I think there's a lot of work that has already happened, and but that needs to continue. I think that's the key message, that we need a sustainable plan, that we can continue to work with this large number of farm workers that is very unique to our region, the highest number in the province, and some of the challenges that we are seeing in this population is very unique. And hoping that when everyone is sitting at the table and we're all put our head together collectively, we can find some great answers and great resolution to some of these challenges.
I'll save my last one for the follow-up.
Okay. Any questions from CBC?
Yes, good morning. Dr. Ahmed, if I could just go off of what you just said there. I mean, there was calls for greater coordination from the province when it comes to the COVID-19 situation on area farms. And I believe the health unit was part of a call last week for greater coordination, and the province is yet to respond. I'm just wondering what kind of coordination the health unit is looking for.
So I am not sure which specific meeting that you're referring to, because we are having a number of meetings every day with different partners on different topics. But I guess from a coordination perspective, the key piece would be important for all of us is to recognize the roles of different ministries, and also ensuring that they're all connected. And we're all doing the work that is needed, and supplementing and complementing each other's work. I think the different ministries that are involved right now is MAFRA, Ministry of Health, Ministry of Labor, the local municipalities, the role of the federal government in the Temporary Foreign Workers Program, and even the local leadership here, the local emergency responders here, and then some support from the province, the Provincial Emergency Operations Center, and everyone. So I think it's all hands on deck, just because of the complexity of what we are dealing with right now. It does require better coordination and collaboration between all partners and everyone involved.
We also learned that the Ontario government hired a private third-party company to do testing on the area farms. What's your reaction to that from a public health standpoint?
So I think from a public health standpoint, we're focused on getting the work done. The initiative that was launched by the Ontario Health in collaboration with EMS and Erie Shores Healthcare, their assessment center was designed and set up in place to allow maximum utilization of the resources by bringing all these bringing all these farm workers to get tested and then appropriately transferred back to their farm. What they found some challenges in terms of bringing in these workers and a request from these farm owners operators to maybe have some of these tests available on site. And looking at from a resource perspective, obviously we need to balance that need of resource, and the private company, if they're able to do that service in a safe manner, I have no concerns about that. But I think it just needs to be put into perspective and looking into the greater good. If testing is something that is needed, and if they are the one that can provide that level of testing, I have no concerns with that.
Thank you.
Any questions from Blackburn?
Yeah, I'm just wondering, is there a timeline for this study, or is it just kind of the length of the pandemic?
That's a good question. Our initial goal was to continue the study for 6 months post-crisis. And we'll have to see as the situation evolves, as we're, anticipating a second wave of infection. So right now we are anticipating 2 years, because we'd like to capture when it's, the post-pandemic, to see how we have readapted to, if it measures anything comparable to pre-COVID. So right now we have anticipated for 2 years of follow-up, but we'll see as the situation evolves.
And so the people who will participate will be doing surveys twice a month for the next 2.5 years-ish? Is that the commitment you're looking for?
Well, we would like that, but I think we'll be monitoring for participant fatigue, which is also understandable. And, we will likely reduce the frequency of surveys as we become more habituated with the COVID situation, and perhaps the different indicators have stabilized. But right now, that's the commitment, and we'll see in the fall if that will be reassessed to reduce the frequency, because we understand that there's a burden.
Thank you.
Any questions from AM 800?
Either for Teresa or Dr. Ahmed, just looking for clarification on the enforcement. I believe Teresa said 154 since the beginning of July. but last week it was reported 220 since June 30th. So is it 374 or is it 154? Just looking for clarification on the number.
So the number that I reported was like on-site and complaints. And so that was from July, like the beginning of July. And last week we did 88 inspections. And over the weekend there were, I think the question yesterday was specific to Kingsville and Leamington, and there were 5 complaints we followed up on the weekend.
Teresa, are these numbers, I'm not sure if alarming is the right word, but was the health unit expecting numbers like this when it comes to complaints?
I think as people are going out and experiencing, life on patios and in other areas, if they are observing something they're concerned about, I think they are able to identify that they'd like someone to hear them and to be able to follow up, and that is the health unit. And so I don't think it's alarming, but I think it's to be expected that as we open up, people are going to identify those that are not being in compliance, because it is a responsibility for all of us. So I don't think it's alarming. I think it is to be expected, but we hope that the number of complaints go down. Because the messaging has never changed. All those public health measures remain in place.
Does this add additional stresses for you and your team? Obviously, you guys have been working hard since prior to the pandemic, but to have, additional officers out there to make sure businesses, individuals are following these procedures and safety measures, does this put additional stresses on your team, and did you have to bring more people in for this?
It does put additional stress on our existing team. We do have a board meeting coming up on Thursday, and we will be talking about additional staffing as COVID continues. The resources that we have dedicated to COVID is quite a bit internally, and externally we are also using other health unit staff. But we will have a good conversation with our board, because our resources are very thin right now.
Thanks, Teresa.
Any questions from Windsorite?
My question is for the researchers. What conclusions are you hoping to make from the study, and what types of future public health policies do you hope the data will inform?
Those are some very good questions. We're hoping that we get enough detailed information from the participants to really understand how the different measures have impacted them. So understanding, in terms of, let's say, household income, food and health security, because those are quite important indicators of well-being as well, mental health, health as well. So we have a variety of indicators that we're quite interested in. And just to get a general idea of how people are doing, and then to see how this evolves over time. And hopefully, because, we're not doing this during the peak crisis when it was first introduced, but now we hope that we see that these indicators are improving over time. And we're hoping that the goal is to work with our public health partners and providing the information needed to tailor interventions or to develop interventions that can help support people. For example, mental health services, that's one of the, a crucial aspect that we're interested in for this study, and understanding, how people are coping. There's early indications that this has had a major impact on the mental health of Canadians. So understanding how at the local level can mental health service access be improved, and what exactly needs to be put in place to help with the access and to reduce the barriers to mental health services. So that's one example. And I think other examples include activity spaces. So understanding, where people are going to play outside, kids and adults, and understanding, and this is more of a longer term objective, but understanding how cities are designed, and if this information can be used to help improve the design of cities to improve the green space, the shared green space that people have access to.
And just in case I missed it, are you looking for voluntary sign up? Can people just go to the website to participate, or is that something that's being done through the health unit?
No, we have a study website, and through the study website, people can you can click on the link, and then they'll read about the study, and then they can consent and then participate. It doesn't need to happen through the health unit. They
Okay,
can do it
thank you.
directly. Thank you.
Any further questions from the Windsor Star?
Just about filling out the surveys. Can people sign up right now? Is it live?
Yep, it's live, and they should not have any problems. And for those that would like to participate but can't complete the questionnaire online, there is a general email that they can send us an email to, and we can help them with the survey over the phone.
Thank you.
Any further questions from CTV?
So Kevin, you're out here today doing your thing, trying to create some awareness for it. So after today, what kind of things will you do to sort of connect with the community to get this out there a little bit more?
Well, yeah, I mean, obviously we have our institutional media release that will go out, trying to engage with, some of our students and, the other faculty that, within our program, and reach out to the people that we know. I think these things are typically organic. As Kate mentioned before, this is something that anyone can sign up for. Tell a friend if you think that it's important information that needs to be heard, and hopefully it grows that way.
Okay, like I'm thinking partnerships with the school boards at some point too in the future, right? That kind of thing. Oh
yeah, I mean So definitely. I mean, one of the things that goes on behind the scenes for any of these studies is, they're done in an ethical manner, right? And you have to get, support from many different parts. But obviously, this is something that we would, a direction that we'd like to go to at some point. And I think Kate, maybe can speak a little bit more to this. But in Montreal, I believe that they were going that way as well. But maybe she can speak to that.
Yes, actually, we are. Well, it's a different study, but we're conducting a seroprevalence study on children in schools in Montreal and in daycare centers. But there is a questionnaire aspect to that study, which is similar to some of the questions that will be that is in the Cohesion study.
All right, cool.
Well, hey, good luck to you guys. Thanks.
And just to add, the Health Unit will be promoting the study through our partnerships and social media and our website as well, and through the school boards and other avenues as well.
All right, thank you.
Any further questions from
CBC?
Yes, please. Dr. Ahmed, we did talk about fentanyl overdoses last week in one of your daily updates, but over the weekend there was another spike in overdoses that Windsor Police responded to. Any further updates or anything you'd like to add on that situation?
Not really. I think we just reported what we have found. The key part is fentanyl was found in most of these overdoses, which is a critical piece because of the potency of fentanyl and the potential for it to cause overdose immediately and potentially lead to death as well. So I think it's important, as some of the measures that we identified, that there are people who may be at a higher risk, and ensuring that how and where they're getting their supplies from is also critical, and ensuring that if you know someone who use a substance for any reason, do they have naloxone kit available? Do you have naloxone kit available, or is there any need to maybe just look at your stocks again, and ensuring that it's everyone is prepared. So I think that's the key message right now. Working from every angle, from a prevention perspective, for people understanding that they're not getting into that situation where they end up in looking to substance to control their stress, anxiety, or any other concerns. And those people who are using it, ensuring that they are not getting their supplies from individuals who are maybe potentially giving them a tainted supply. And then from an enforcement perspective, so everyone is needed to support these vulnerable people and to prevent many of these overdoses. So that's just the message that we want to just reiterate, There are a number of supports out there in the community. Please visit our website for a complete list of what is out there and what kind of support you can access. You can go to our website, www.wecoss.ca, bcos.ca, for a complete list of all the resources that are available to our community.
Thank you.
Any further questions from Black
No, thank you.
AM 800?
Dr. Ahmed, yesterday you touched on the border. Almost every day we touch on the border, but reports are out there that the border will remain closed for non-essential travel until August 21st. Being a border community, just want to get your thoughts. Do you welcome that news, obviously?
Well, what we are seeing in the United States is definitely something which is very different than what we are experiencing here. So it does worry me if border is open for everything. There's a strong potential that some of these individuals may come here, or even our people will go and contract COVID and then come back in the community. So I think having a tighter restriction, at least at this stage of the game, is very much appreciated, because it does have an impact on our community. We know how many people commuting every day, even right now, and then the potential increase that we will see if these border restrictions are loosened up. So I think we'll have to just be careful and continue to monitor the situation, what's happening in the United States, before we open it up for general public.
So is it safe to say, until their numbers go down, you're hoping the border for non-essential travel remains closed until the numbers in the United States go down?
Well, I think that will be my thought, thinking and focusing obviously on the health side of the things, but recognizing that there are other aspects that the politicians and the decision makers have to consider. But purely from a health perspective, yes, definitely that would be my recommendation.
Thank you.
Any further questions from Windsorite?
No, thank you.
Okay, thank you, everyone. Thank you to Dr. Milne and Dr. Zinsser for joining us today.
Thank you.
Thank you.
Thanks very much for having us.
Thank you. Agreed.